ground, which we've now solved, hopefully.
Yep. Good.
So the listeners don't have to endure that whining. But what we've got now is really want to talk about ingrown toenails. That's this sort of subject for this podcast today.
Right.
So really, we've sort of got a little outline. Let's stick to that. I want to try and get across as much information as I can to the listeners. And you're the expert. Now, I have to admit, I've had a little bit of a dig myself in my own toenails over the years, and I think that's where a lot of people have. Is it something that's really common? Because I've noticed a lot of people on the internet are looking for answers and solutions referencing ingrowing toenails.
Yeah, I mean, ingrown toenails is obviously quite a common problem that we see as podiatrists. I generally see round about 600 to 700 cases a year in our clinics. Most patients that we see have had a little dig, in inverted commas, should we say, a little bit of home surgery, and obviously that tends to actually accelerate the whole condition. So obviously the first course of action really is not to have a little play around, is to see a professional with immediate effect. So obviously the whole toe doesn't get into the infected state, and in a lot of cases, unfortunately, when people have been having a little dig, quite often the only way to eradicate the problem is to undergo a surgical excision of the nail.
Wow.
Obviously, we want to try and avoid that. So really, it's all about patient education. Generally, when patients come to see us, if it's in the early stages, whereby they have either had a little go themselves, or either there's been some form of external trauma or tight footwear, etc., they generally start to see a little bit of puffiness or swelling around the nail margin. That's where the side of the nail is parallel to the flesh at the side of the toe. Obviously, pain starts to kick in when more pressure is applied to the area, causing the nail to embed into the side of the flesh. Unfortunately, these things, when they get particularly bad, often when patients have tried to cut the nail in an incorrect way, a small spike or spicule of nail will dig into the side wall of the toe, and quite often they'll get an infection in there. Normally the first course of action is to try them on some antibiotics and a bit of home treatment, wiping over with sterile wipes, etc., to try and put the infection at bay. But unfortunately, when the problem has gone on for a number of weeks, in some cases months, where they haven't been able to quell the infection, we have to resort to some sort of professional treatment in order to try and remove the nail.
So, I mean, just so I know, let's talk about the signs and symptoms of so you've got an ingrowing problem, because I know that sometimes you think, oh, that's a bit painful. I know I've done it myself. I've been wearing shoes and I thought, oh, that my toe's starting to feel a bit painful. When I touch the edge of the margin of the nail. So how do I know, or how do people recognise that it is an ingrowing toenail they've actually got?
Well, generally, when the problem has been going on for a while, when the nail actually starts to impinge and grow into the side wall of the toe, they start to see some very strange flesh forming. It's called hypergranulation tissue. It looks sort of very red. If you knock it, it can bleed quite profusely and easily. And what's happening is the body is starting to react to the spike of nail going into the side of the toe, and there are a lot of skin cell changes where this material called hypergranulation tissue tends to grow underneath and around the actual spike to almost lift it away from the edge of the nail margin. Normally at that stage is when we tend to see patients. They've normally had some courses of antibiotics which will help quell the infection. But of course it doesn't sort the problem out. That's normally the end stage. In the early stages, you're going to get some sensitivity in the area. You're going to get some redness and swelling, etc. And sometimes you can get a slight watery discharge, sometimes tinged with blood around the area. But again, just please don't have a go yourself. People tend to use anything from and well, I've had patients that have come in that have even tried using screwdrivers to try and remove industrial nail cutters, all this sort of stuff. So just don't mess around. Just get to see a suitably qualified professional who's able to hopefully ease the problem in the first case. But of course, when these signs and symptoms start to develop into hypergranulation tissue, even the healthcare professional, the podiatrist, is not really in a position to be able to eradicate the problem, because there's obviously so much pain involved there. So we often then have to resort to a small surgical procedure to try and successfully remove the edge of the nail that's actually causing the problem.
Yeah, I know, we'll get into that in a minute. I know, because I have actually suffered, and it can be very painful indeed.
Yeah, I mean, taking paracetamol or some other non-steroidal anti-inflammatory is one way of trying to sort of quell some of the pain symptoms. But of course, it's very much like, as an analogy, you could go out into your garden and start pruning your roses. You know, if a thorn comes off and gets stuck in your thumb, well, the first thing you want to do is you want to remove the thorn. You don't want to leave it in there for weeks and weeks until it gets all nasty. You want to try and sort the problem out at its earliest stages.
Absolutely. It's so when it breaks the skin, is that when it starts, becoming prone to infection, when it's actually broken the skin?
Absolutely. I mean, when the nail bed has pierced the side of the flesh, obviously there's a portal of entry for some bacterial infection to get into that area, and that's when you see the skin starting to change, becoming red and swollen, etc. And then eventually it will form this hypergranulation tissue we've just spoken about.
You must have seen some pretty horrible pictures over the years you've been in this game.
Yeah, we've got quite a gallery of nasty pictures, but we don't want to be seeing them. We want patients in who will hopefully take our advice, be educationalised, and not let the problem get to that end stage.
Yeah, I'm sure it's like most things. Human nature being what human nature is, they leave it until it's past its the initial stages, and it's gone into the more severe stages.
Yeah, certainly people do leave it until it's gone by its sell-by date. I mean, I've seen patients in the past, unfortunately, the cases are sort of fairly rare, but where they've actually left these problems for weeks going into months, and sometimes years, and how people can try to perform sporting activities, go to work, dance, etc., with these extremely painful conditions. I remember someone told me about 4 or 5 years ago, there was a survey done by some company in Leeds city centre, where they were asking people of all the medical conditions or affectations that you may have suffered, which was the most painful. People may have mentioned, for example, gallstones, this sort of stuff, kidney stones, so I say it was very, very painful, or back pain. But what came out on top, believe it or not, was the ingrown toenail as the most common, everyday, most painful condition. And we do see a lot of them, unfortunately.